Hi, Dr. Min again, Mini Health Talk to get you healthy again. Today, we're going to talk about complex regional pain syndrome. Complex regional pain syndrome is a minor injury induces a great deal of pain and suffering. Let's get started. So what's the causes of the complex regional pain syndrome? The cause is very simple. Sometimes the amputation is the worst because that happens to the phantom leg a lot. But sometimes just a bruises, burn, or small cuts, fractures, minor surgery, or even the small needle sticks, radiation therapy, that's the worst, and sprain. So in other words, the cause of the problem can disappear, but the pain will be long lasting. Next page, please. So let's see the pathology of complex regional pain syndrome. The pathology is initial injuries or disease. This initial injury or disease can be really small. Sometimes you don't even know. Cause massive sympathetic nerve system dysfunction. Sympathetic nerve is overacting to it. Number two, the sympathetic nerve massive malfunction causes blood vessels extreme constriction and dilations. The blood vessels, small blood vessels, extreme constriction and dilations. Those blood vessel activities, the tissue involved in the extreme pain and swollen due to the blood vessels activities. So the pathology is very clear. It's a small injury, induces sympathetic nerve overaction and blood vessel extreme activities cause pain and swelling. Next page, please. So the clinical manifestations is debilitating aching and pain and burning, cold. Sometimes you feel the thing so deep and bad, throbbing, intolerable. Most people have to take a narcotic to stop the pain, but at a certain degree, even narcotic won't help them anymore. Red, blue, the affected region can be really red, warm, or really blue and cold, icy cold, and swollen. Next page, please. So as far as we know the pathologists, so far the Western medicine, except to give the patient pain pills, they don't have any cure for that. The good thing is about acupuncture will address the underlying cause of the sympathetic overreaction. We treat it. Number one, acupuncture is meant to raise up the qi levels, so the qi's energy flow levels, and decrease sympathetic nerve overactions. The point I use is Do 20, so on the top of the head, 四神聪 to raise up the qi levels. I use Virgin Chestnut 3, 10, stomach 36, ring 24 to decrease sympathetic nerve overactions. This group of points I used for many kind of sympathetic reaction, just like a gag reflex, nausea, vomiting, or coughing. It works pretty efficiently. And image acupuncture reduces pain. Let's say you have a pain on your foot, we use the image in the hand to reduce the pain. If you have a hand pain, we use the imaging in the foot. Okay, next page, please. Chinese herbal medicine therapy, the principle are just same as acupuncture. We use 四逆汤, so restore the heart yang. So when you feel the patients because of sympathetic nerve overactions, the foot is so cold, or hand is so cold, icy cold, you use 四逆汤 to restore the heart yang. 四逆汤is originally designed to just rescue the people who are dying with extremely cold in the body. But I found this works great on the regional complex pain syndrome. Stress 1 to remove the blood stagnation. Stress 1 is made of same thing as raise up qi and moving the blood. Early stage, I use 盐胡梭、白芷、乳香、没药 to move the qi to relieve the pain. This is such a group of Chinese medicine, almost like painkillers. They move the qi to relieve the pain. This is the early stage. Later stage, I will address hormone imbalances. So once I get the middle of the pain, I still tonify the yang, I still move in the blood, but at this stage, I don't use the pain relief qi movement herbal much, but instead I use 当归芍药汤 and 五子衍宗丸 to balance the hormones in the later recovery. Next, let's do a case study and see how I treat the regional complex pain syndromes in my clinic. So there's a 32-year-old white female came on the wheelchair, so with both feet intolerable burning pain, especially the left side, which keep her from standing and working. So she has so much pain, it's debilitating. She's on welfare, so debilitating. Her feet were icy cold, almost black, and very sensitive to touch. Narcotic didn't help her much. Each time you have so much pain, intolerable, you cannot sleep, you cannot walk, you take a narcotic, first it helps, and later on they don't help at all. The foot still cold, icy cold and pain. It's almost feel like the surgeon feel like to amputate her foot. And in desperation, she come to me. When I diagnosed her, her tongue was puffing with sublingual vein dilated up the chest level. So when you watch the sublingual vein, the more dilated the vein, the higher level it is, the weaker the heart. So my initial diagnosis was heart yang deficiency with blood stasis. So her heart yang so weak that cannot disperse yang energy and the blood flows to the foot. So my initial acupuncture treatment is do 20 四神聪, hand foot image, Larynx 310, stomach surgery 24. My initial herb formula is 四逆汤 to warm up heart yang, stress 1, moving the blood, 白芷、细辛、乳香、没药、盐胡梭 to relieve the pain. Next page, please. After months of treatment, the patient was able to walk again without a wheelchair. Would that be wonderful? After your acupuncture and Chinese herbal medicine, the patient get out of the wheelchair. What a wonderful case is that. I switched to corrective care. So at this stage, when she doesn't have a great deal of pain, you don't want to focus on the symptom. You focus on the cause of the symptom. So I use 四逆汤 10, stress 1 10, 右归丸 30, talking about kidney yang. 当归芍药汤 20, 毛冬青 10, 葛根 10, 绢碧汤 10. So after 3 months treatment, patient's foot turned into normal. Patient was able to work and study without problems. Later on, she started to become an acupuncturist. Do you feel so great to be an acupuncturist? For somebody who suffers from so much pain, there's no other way to take care of it, and you do the acupuncture, you do the herb, rescue their lives, let them live again, let them want to be an acupuncturist. Next. I want to thank you again to join me today for the mini health talk to get yourself healthy, if you're a practitioner, to get your patient recover faster. If you like my programs, please sum up or subscribe to our channels. We'll see you next time.